Hi everyone, my name is Kayla and today I will be presenting on osteosarcoma. So osteosarcoma is going to be a type of bone cancer. It is super rare and so are these three different types of bone cancers as well, but there's going to be primarily bone cancers which are bone sarcomas that form slash originate in your bones, and then there's going to be secondary bone cancers which form in other parts of your body and then they spread. So for the three types of primarily bone cancers, there's going to be chondrosarcoma, which is a tumor that grows in soft connective tissue, helping bones and joints move. Then there's osteosarcoma, which is going to be my main focus, and that's where tumors grow in cells, where new bone tissue is going to be forming. And then there's Ewing sarcoma, where the tumor develops in bones and surrounding soft tissues. So what is osteosarcoma? Like I said, sarcoma tumors are extremely rare, but sarcoma is going to stand for cancer that grows in connective tissues like bone, cartilage, and muscles, and bone. Osteosarcoma is going to be a primarily malignant bone cancer that develops in long bones of the body, like your arms and legs, but it's going to be most often seen in knees and humerus. And there's different tumor grades, and these really just indicates how aggressive the tumors appear and how likely the cancer is to spread. So there's going to be low grades, intermediate grade, and high grades. For the incidence, I have two graphs here to kind of indicate, kind of represent these numbers. But for the incidence, there's about 3 to 4.5 cases per million people per year globally, and it's most commonly seen in children and adolescents. And there's about 1,000 new cases per year in the US, so it's not, I don't really think it's a lot, but it's going to be most commonly seen in males. So you can see on this graph, so the yellow is going to be the males and the bluish green color is going to be the females. So you can see how that rate is higher for the male population. And this cancer has a bimodal age, meaning there's two peak periods depending on the age, right? So the first one is going to be the primarily peak in adolescents and young adults, so it's seen around 15 to 19. And the secondary peak is going to be at 60 years old, and you can kind of see it here. It starts to, that peak is right here once you're older than 60. And then you'll see why these peaks are important in the risk factors. As for the prevalence, so due to how rare osteosarcoma is, the overall prevalence of it is going to be low compared to other cancers, so there's not much reported data on it. And for the survival rate of osteosarcoma, it's going to be a 5-year relative survival rate, and it all really depends on the location, aggressiveness, and how the cancer spreads, so how it metastasizes. As for the risk factors, most osteosarcoma cases are going to be random, but here are some risk factors. So for the age, most osteosarcoma cases are going to be seen during teen growth spurt, so like puberty. So that's where that primarily what's it the primary peak occurs, right? So in the 15 and 19, that's when usually males go through puberty, right? And then for the height, so children with this cancer are usually seen tall for their age, gender, like I already said earlier, but men are more common to get it than women are. And as well, another risk factor is going to be radiation treatment. So if someone who has already had cancer or has been exposed to any kind of radiation, they are going to have a slightly higher risk, but it's about 2%. So then again, it's not as likely, but it's still a bit higher. For bone diseases, so people with non-cancerous bone diseases such as pagan disease, which is usually seen over the age of 50, or multiple hereditary osteochondromas like benign bone tumors have a slightly higher risk. Genetic factors as well play a huge role. So there's about an 18 to 28 frequency of germline mutations that occur in young patients. And then some of these syndromes are going to include retinoblastoma, a rare eye cancer, Lie-Froman syndrome, Rothman-Thompson syndrome, Diamond-Blackfan anemia, Bloom syndrome, and Werner syndrome. As for the pathogenesis, these are the risk factors that I just talked about, and we're going to take it this perspective of how this can be a threat and how this can eventually evolve to osteosarcoma. But we have the somatic alterations, germline genetics, growth-related, and environmental factors. So to sort of break this down a bit more, for genetic mutations, so there can be tumor suppressor gene dysfunctions, And mainly this will affect genes P53 and RB, which are retinoblastoma, and they can experience mutations and lose their protectability against cancer. RB is really important for controlling our cell cycle, and when these are mutated, they can't stop any abnormal growth. Additionally, chromosomal changes are amplified, so they create more copies, or they can even lose copies as well. Transcription factors, so for deregulation, if that occurs, that means the genes that are controlled on how other genes are turned off and on eventually go haywire, and this leads to uncontrolled production of proteins that drive tumor growth. As for environmental factors, right, the radiation or the UV exposure can damage your DNA, and this can contribute to the process of it. But then again, it's that still at 2%, so it's really not as likely. But overall, these risk factors will then have a deactivation of tumor suppressor oncogenes as well as activation of oncogenes, right? The proliferation of malignant osteoblasts, and these formations are overcrowding of the osteo tissue and bone. So eventually, what this means is that this leads to osteoblasts dividing uncontrollably, so forming malignant tumors in the bone. The tumor can grow, destroy the bone, and even spread to other parts of the body, as we can kind of see here. For signs and symptoms of osteosarcoma, so bone pain and swelling can occur, a mass, so a tumor that can be felt through the skin, swelling and redness at the tumor site, increased pain with lifting, limping, limited movement, unexplained fevers, and even broken bones that happen suddenly or form from injuries that normally wouldn't cause injury, so pathologic fractures. As for the diagnosis and test, so first, if someone is trying to test to see if they have bone cancer, someone would go through a thorough history and physical examination. Then they can either get a biopsy, blood test, CT scan, MRI, or even an X-ray. But there's also new forms of treatments as well. There's medication, immunotherapy, peptide vaccines, and also targeted therapy. For screening and prevention, due to how rare osteosarcoma is, and it's very random, and experts still aren't sure why to this day, why osteosarcoma develops, it's not as preventable. However, it's really recommended to talk to your healthcare provider and any genetic testing for cancer's risk, or even if someone in your family, let's say like a dad has cancer or has osteosarcoma, just to make sure get those children's or whoever it is to get blood tests and get these genetic testings. That way they know how high risk they are or if they are not. As for treatments, there's going to be chemotherapy and radiation therapy. These can be combined as well. Chemo can be combined to different types of surgeries. So, like limb salvage surgery, which then someone can get like a bone graft or a prosthesis as well. Amputation of the arm, leg, or whatever body part it would be. Rotation plasty as well. But for the social factors, I took this data from a piece of literature that I read from 2022, and it was looking at different types of the primary bone cancer. So I just kind of mainly focused on the data that they presented on osteosarcoma, but they found out that there's a lower socioeconomic status linked to increased risk of metastatic disease and large tumors, as well as lower educational levels, lower income, and higher unemployment rates are usually associated with an increase of osteosarcoma, delayed treatment, and overall worse prognosis. And also, patients who live more in the rural areas in comparison to urban areas, they are less likely to receive that treatment at specialized cancer centers. And as well, they found data of patients who are Black. They are more likely to have present with metastatic tumors, and as well, they are more likely to have larger tumor sizes as well. But here are my references. Thank you.